Hello, good evening, everyone. So, I would like to welcome you all for another session of Project Ask Physios. So, today we have a very interesting topic with us, and it's osteopathy. A lot of you people had inquired that, sir, when we can have an osteopathy session, when we can have a live session, and lot of people requested us for conducting such a session. And today we have such session. I am very happy to see all of the people who are joining, and we will be starting very shortly. We will start at 8:40. Telling you about the instructor today, Dr. Mahesh Chakor. He himself is a physiotherapist who has immense experience, lot of experience in this field. He has been practicing this from past many years. Dr. Mahesh Chakor, he's a consultant physiotherapist. He's also osteopath. He's also master of chiropractic adjustments. He did his bachelor's. He's also MBT, and he has done a lot of courses. He has many years of experience with him. He also happens to be my senior, and he has been guiding many people like me. And he has done a lot of courses from you know outside. He has done his course of osteopathy from Sweden. He has done his course of DNS from Czech Republic. And he has been practicing lot of therapies, lot of other various techniques and different techniques. And he has been guiding lot of, he takes workshops, he teaches young individuals, he takes lessons for all these people. So basically he's into lot of training and lot of teaching part which he does. And he has today agreed to take a session for us also. And I hope it will be a very good session. It will be a very enlightening session, because a lot of young people who have very less idea about osteopathy, about chiropractic. And last week we had a session of cupping therapy as well. So we are moving towards a lot of such sessions where there are a lot of manual therapy techniques, lot of manual techniques which are being used to take care of pain. So let's see, today's session will be a very good session if we keep all these things in mind. So first of all, I would like to ask everyone who have joined, where are you people from? Please mention your location. Please mention whether you are a practitioner, whether you are a student. Please mention your state, and how many already practice osteopathy. Please comment in the comment box. Please let us know who all are there. Please introduce yourself. Yes, please. So let me see who all have entered the session, who all are there. Yes, please introduce yourselves. Let us know. We have Krishna Chandra. Good evening, Krishna. We have Bhavika Keswani from Pune. Very good. We have Pinky from New Delhi. That's great. That's great. Yeah, lot of people. So, how many of you are into practice of osteopathy, or have you ever attended any session, or have you done any course, any workshop? Dr. Mahesh will be joining in, I guess, 2 3 more minutes. We'll start the session by 8:40. Till that time, we can interact amongst each other. We can know how many of you are practicing, how many of you have no idea about. Okay, Pinky is not doing anywhere. Dr. Krishna is experienced. Dr. Alpesh from Pune. Good evening, Dr. Alpesh. Dr. Imran Khan from Delhi. Eva Scott from Delhi. Great, great. Thank you. Thank you, all of you, for joining. Thank you. So, how many of you practice osteopathy, or how many of you have, ever attended any workshop, any session? Okay, Dr. Krishna is practicing chiropractic. That's good. That's good. A lot of people ask me what is the difference between osteopathy and chiropractic. So I think this is one of the major questions which we will ask Dr. Mahesh Chakor, and let's hope Dr. Chakor will be able to take all our doubts and clear all your questions also. Some Dr. Hina Khan from MP. Great. Dr. Pinky has attended cupping and IST workshop. Okay, Dr. Pinky, that's great. So let's hope we have a good session. How many of you people have been practicing osteopathy, and what is in your suggestion? Do you see any difference in your patients? How do you deal with patients, and what exactly do patients ask you about osteopathy? Yes, please. Okay. You have no idea about chiropractic and osteopathy. Okay, Pinky. Definitely, you will have some idea about osteopathy today. Chiropractic, we'll see what we can do. But definitely, osteopathy, whatever doubts you have, we will definitely clear those. Yeah. Any other new people joining? Yes, tell me. I can see 14 people. Yes. Dr. Shabab Fatima, good evening. Good evening. So we are just discussing how many people, how many out of you practice any sort of osteopathy, chiropractic, or do you have any idea? So please, guys, just let me know. What do you feel? How many of you practice? Anything you want to share? I think we will wait till 8:45. We will wait for 6 more minutes, and then we will start the session. So till that time, you guys can share your experiences with us. Let us know what do you think. And also, I would like to ask, how's the practice currently? From whichever states you are, how's your practice currently going on? How is the patient flow? What do you guys tell me? Is the patient flow as same as it was pre-COVID, or has the patients decreased or have it increased? Please let me know your views in the comment box. Yes. Yes, tell me, guys, tell me. Whatever questions you have today on osteopathy, whatever questions you want to ask, please, please let us know. Okay, we have Dr. Mahesh with us. Good evening, sir.
Good evening.
Sir, like I was just introducing you,
Yes,
and I was just sharing ki what exactly Mahesh sir has been experience of so many years. He has learned so many techniques. He usually goes and upgrades himself. He goes to many countries. He tries to learn something new, something different. So ultimately, I would like to hear it from your mouth only exactly what you do, what you teach, and so many people are there. Kindly share with us your experience, sir,
sure.
please.
First of all, I would like to thank you, Dr. Prerak, for giving me this opportunity.
Sure, sir.
And I would like to thank your team, Project Ask Physios, to giving me such a wonderful opportunity and platform just to explain about osteopathy
Sir.
and about my concept, which I developed is advanced posture alignment. So you already briefed about me from where I studied and how I'm still pursuing like to give the best to my patient, to the society, to
Sir.
my colleagues. So I'm not going to go detail into that. So if you allow me, I'll go directly with the slides, PPT.
Okay.
While reading that, any kind of doubt is there. Yes, definitely, you can stop me in between, Dr. Prera.
Sir.
I'm happy to answer the question.
Okay, sir.
We'll go in three segment. First
Okay.
is introduction of osteopathy. In detail, I'll go. Definitely, it is a brief course where there is a time limitation, but still, I'll just keep myself to the promise. I'll clear each and every doubts in shortest and briefest way.
Thank you, sir.
Then I'll go for assessment part, and then treatment means osteopathic approach part, and
Okay.
then
ठीक है.
okay. So to
Sure,
allow me,
sir.
let's go for the introduction
Please, sir.
by the screen. So, Dr. Perak, can you
Yes, sir.
see this?
Yes, sir.
Yeah. So I'm welcoming everyone on this platform, and again thanking everyone to joining me on this such amazing platform as Project Ask Physios. So I'm Dr. Mahesh Kaur, and I'm a director of the Physio 9 clinic in Pune. I have two locations, Biman Nagar and Magadpatta, as well as I have extended my arms in Bhopal also, MP, as health Veda clinic, and many more plans coming en route, as well as in this many years practice, like with my study, my plans. I thought why not to develop one concept. So from last 6 years, I'm using this concept named as advanced postural alignment. I trademarked it also. So let's come to the point: osteopathy. So I think one of a doctor had a question between osteopathy, chiropractic, and physiotherapy. Definitely, I would be happy to go in detail. First of all, just get a very brief idea about osteopathy is founded by Dr. A.T. Steele in 1874, quite long back. So there was a incident happened with Dr. A.T. Steele. You can simply Google it. You'll get to know such an amazing story after osteopathy. So I'm not the person who can talk about Dr. A.T. Still. So I would leave it to you all guys. You can just Google about how incidentally osteopathic medicine was founded by Dr. A.T. Still. And it is very well recognized by American Osteopathic Associations. So it defines as a complete system of healthcare with a philosophy that combines the needs of the patient with the current practice of medicine. So here in osteopathy, it's considered to be a spiritual treatment, actually speaking, where we call it as a whole body is one unit. So here we can see that I just said that whole body is one unit. How? The human body is a machine run by unseen force called life, and definitely it's run harmoniously with the liberty of blood, nerves, arteries from the generating points to their destination. So how an entire body is interlinked to each other, actually speaking. So diseases occur, deformity occur. How? When there is an imbalance. Uh, Dr. Perak, actually,
Yes, sir.
I osteopathy and chiropractic only on the basis of making things simple.
Okay.
So in osteopathy also, it is also believing in the same concept. Make things simple. Don't make it unnecessarily complicated.
Okay.
So when there is imbalance, disease or deformity will occur. When there is balance, you will get health. Such an easy concept.
So,
So here it's mentioned as diseases occur due to damaged articulations or faulty lesions, whether it's a skeletal or muscular, whether any associated structures, actually speaking. So when there is a imbalance, make it balance and come to your health. So easy.
okay.
Units are there on which osteopathy is actually based. Human body is a functional unit where mind, body, spirit are interconnected. And each form and functions are interdependent, actually speaking. As I already explained about, whole body is one unit. So that's why it has an innate ability to heal itself. It is simply based upon individualized rational application of the above tenets. Again, I would like to tell about, yes, your body is very like self-healing, self-regulating. If you maintain your health very well, your health is a natural state of the body. And the body possesses complex homeostatic self-regulatory mechanism, which allows for self-healing and self-regulation easily. So when there is a disease, when a part of the body is functioning suboptimal, other parts of the body come out of their natural state of the health just to compensate for the dysfunction. As I already mentioned about, when there is an imbalance, make it balance. So during this compensatory process, however, new dysfunctions may arise. Osteopathic manipulative medicine aims to restore the body's self-healing capacity. So overall, everybody can see that it is actually focusing on self-healing by balancing it. So by decreasing allostatic load or the physiologic effects of chronic bodily stresses, which actually allows to increase immune system. One more tenet I would like to get everybody to look at here is gate theory. Basically, osteopathy, as we already saw, that it is based on your structure, muscle, and your structures, but it is majorly based on fascia. We all are much aware as a physiotherapist. Strongly, we encourage this concept, fascia. So this concept gate theory is based on fascia again, balancing of fascia. So what is gate theory? It is again same what we already studied in our profession as pain gate mechanism. In osteopathy, it is named as gate theory. What it says, when you feel a sensation other than pain, just like rubbing, touch, even a mild impulse like manual or electrical, your spinal column will actually close the gate and not let pain impulses pass to the brain. Dr. Prerak, we studied the same as a pain gate mechanism, right? In our
Yes, sir.
profession.
Yes, sir.
So same, they are using it in osteopathy as a gate
Okay.
theory.
Okay.
Yeah. So how I would like to again emphasize on fascia. Definitely, in further details, I would like to go more in detail about fascia also, like
Mhm.
how to take care of fascia and everything. So now let's come to the point of osteopathic manipulation and techniques, how there is a direct and indirect approaches. So in direct treatment approach, there is soft tissue techniques like direct lateral or linear stretching of muscle and fascia. Okay, frequently used to prepare or just to conclude oral treatment. There is articulatory treatment system like low velocity, moderate to high amplitude, springing, focused on joint functioning. Okay, where we actually mention it as a manipulative theory, like manipulations. Again, uh, there is an approach called high velocity, low amplitude. So in chiropractic, it is more over short lever techniques, and osteopathy it is long lever technique. That's why it is high velocity, low amplitude, use of fast thrust through restrictive articulator barriers, which is most people like just they can hear cracking or popping. MET. This is also we studied amazingly in our profession. So this is like quite an old profession, as we just saw that is founded in 1874. So many techniques like MET, myofascial release, several techniques like PRT, position release therapy, we actually derived from osteopathy. So this muscle energy technique, it uses post isometric relaxation to stretch muscles and increase ROM. The targeted muscle stretch to its barrier. The patient is instructed to move toward ease. Yes, make it easy. While the physician resists by using an isometric counterforce. Inhibition, like slow in direct application of steady pressure to relax muscles or just to reduce muscle contraction. There are few indirect treatment approach as well, like strain counter strain, where uh, they focus on specific tender points. and hold it in the position for almost 90 seconds, after which the tenderness is relieved, like facilitated positional release. I would say position release therapy. So patient spine is placed at neutral position while the isolated segment for treatment is placed at ease. Simply like compression or traction is then added to release further. So we have few more approaches like myofascial release and ligamentous articulatory release. So in today's osteopathic release, I would like to tell everyone this is two major techniques I'm going to use in my today's approach. Definitely, these all are like manual techniques, but I have developed this advanced posture alignment on the basis of majorly this two. After finishing this slide, I would like to tell about what is advanced posture alignment. Here again, I'm going to conclude about difference and major combination between physiotherapy, chiropractic, and osteopathy. So let me talk about myofascial release. It encompasses many of the modalities just to treat restrictions of muscle and fascia. So generally, this technique is not so aggressive. Definitely, it's very easy to use, and we get quick result while doing myofascial release. In ligamentous articulatory strain or release, I would say, here ligaments or joints are placed into a state of balanced tension until a release is felt. Basically, it based on um, three approaches like disengage, exaggerate, and balance. So, what is disengage? Compression or traction of an articulation or any ligament in order to loosen the ligaments in order to allow greater movement. Next process is exaggeration, indirectly taking the articulation, the ligament in all three dimensions, in just to away from the barrier into the original direction of the trauma, just in order to align the ligament just in the position of the original trauma, and in balance where the pressure is taken off of the ligament or articulation by disengagement, and the ligaments are just brought to a uniform tension with exaggeration. One will simply find the steel point. Patient like held at a position of ease until release, then passively moved just to the barrier quickly. So this all what we just saw, that is actually a manual osteopathic techniques. There are two more approach. The one is at cranial osteopathy, where we do balance cranium to sacrum, named very much popular as a craniosacral therapy. So in osteopathy, in cranial field, where a system of treatment that utilizes the intrinsic motion of the cranial and neurological system just to treat whole body. How? Everyone is much aware about, yes, is body fully controlled by your cranium. So simply again here, whatever imbalances are there, whatever lesions are there, just we have to simply balance the rhythm. We have to work on self frequency. Guys, I amazingly got result in migraine or any kind of fascia related things, like where there is a optic neuritis, cervicogenic headache, like such things, in single sessions. And as I would like to tell about, there is one more branch of osteopathy, is visceral. Here we release all diaphragm in the body, and your all visceral organs, including liver, kidney, spleen, uterus, all sphincter releases. So this major three-way how osteopathy works: cranial, visceral, and manual. And I already told everyone about it works majorly on fascia. So I'm quite sure everybody is much aware about fascia, right? It actually forms a myokinetic chain in all over body, like upper limb, lower limb, your entire body, myokinetic chains. So everybody is much aware about the composition of the fascia. Like fascia, it actually bears your 16% of your body's total weight and 25% of your body's total water content. Majorly, it is based upon water and few, I would say, a very little content as a blood. It is a gel-like material is present all over body, connects through a myokinetic chain. Everybody is much aware about myokinetic chains. It is present in upper limb, in lower limb, in your entire trunk as a spiral chain, some of the anterior chain, posterior chain, middle chain, lateral chain. It's a big concept again. Myokinetic chain, again, a big concept that is based upon your antagonist and agonist muscles and how it works, how it balance your bodies in all postures. So osteopathy works majorly on fascia. Now I would like to talk about the concept which I developed is advanced postural alignment. Dr. Prerak, I've done with the slides. Can I come to the screen so
Sure,
I
sir.
can explain very
Please,
easily about the concept?
please, sir.
Yeah, it becomes very easy when
Yes, sir.
we talk in front of the camera. It feels like I'm talking to you.
Yes, sir. Please.
Yeah. So now I would like to go in detail about advanced postural alignment.
Sure, sir.
So here, as a hardcore physiotherapist, I focus on physiotherapy first, then osteopathy, and finally correction with the chiropractic. So let me talk about a major difference everybody is much aware about as a physiotherapist.
Yeah.
We work with stretching, strengthening, all conditioning protocol exercises. With osteopathy, as I already explained in brief about how we work on fascia and structures, it is simply a balancing of this thing. Such a simple example I would like to give today about how osteopathy works. So here, this commonly I explain to my all patients. I'm taking my hand easily, but if I hold my shirt down like this, I can go up to here only. If I leave my shirt, I go very easily. So I simply tell my patient, this is my outer dress, fascia is my inner dress. So when this outer dress is stopping me with my movement, definitely if the inner dress comes in imbalance, definitely it's gonna give you more deformity, region, disease, like in frozen shoulder. I treated my n number of frozen shoulder just by working on lever, visceral way, and manual therapy. So today I'm not going to go deep about visceral and cranial, but I'm going to go just to balance through manipulation, through manual way. Like as I already explained about how fascia, even it actually disturbs your viscera, that actually gives you irritable bowel syndrome. In ladies, especially, there's amenorrhea, dysmenorrhea, all like regarding menses problem happens. Acidity, Many patients comes to me for good. Many whatever the visual deformity they comes to me, I treat them very easily. So this is osteopathy where we balance the imbalances. And in chiropractic, whatever misalignments are there, structural, purely structural, lesser muscular, we align that. So how I do alignment, a correction through osteopathy and chiropractic, and I strengthen that alignment with exercises.
Okay.
So simple concept I developed as an advanced posture alignment. Okay, so you can tell me, Dr. Perak, if any doubts I can answer, or else I'll directly go inside for assessment, and
Sir,
then
we can start with the assessment. Usually we take doubts at the end of the session.
no
10,
problem.
10 minutes. Yeah,
So surely we'll go there to the treatment room.
sure, sir.
Yes, so I'm here in my workstation, I would say, in my treatment room. So first of all, I would like to introduce my colleague, Doctor. Hello. Dr. Prathama. She's helping me by just modeling here with each and every point. I would like to request Dr. Kaivalya to hold the camera. Why I'm not using tripod only, just I can go to each and every muscles in detail. Okay. So, as I already promised about today's osteopathic approach for upper and lower limb. For the first time in this many lecture, I'm gonna cover upper limb and lower limb together. Yeah. So for that, we're gonna go for actual assessment first, and then we're gonna go for releases. First upper limb and then lower limb. Okay. After assessment, I'm gonna tell everyone about the sequence which I follow as per kinetic chains. I'm not gonna go so deep inside. We don't have that much of time. But in today's, this is my chain. What I follow, I'm gonna give a ready-made plate, so which you can simply practice in your daily practice. It will actually help you to get a quicker result. Okay.
Okay, sir.
So first of all, in assessment, two kind of assessment. One is upper limb length test and lower limb length test. So here, I'm going to request my doctor just lie down straight. No, no, no. Yeah. Simply, I'm requesting my doctor, Dr. Abel. I'm just standing exactly next to her head, giving traction completely. She's exactly linear, no changes. And if you can see here in upper limb, fortunately, she's not the case, where very mild difference in her right side creases are down than left one. Very mild difference. But in some of the cases where I actually found at least an inch in differences between when we join together, creases, yes. So this is upper limb length test. It's a very easy test. Ensure that a patient should be linear, straight, and relaxed. You take both upper limb, hold with the traction, and simply check. You will amazed to see that many of the patient, at least 70%, you'll see that it is creases are up or down. That simply says either or, either of the limb is shortened.
Okay.
To balance through osteopathic manipulation, it balances very quickly. Now I'm requesting my doctor to lie on prone. Here again, make sure that patient is linear. How? Yeah. Hold on. Check for earlobes, fine. Relax. Check for straightening. Check for whether the ASIs are to one side. Fine. See, if you can notice that she's on one side now. This is towards left side. So I'm gonna help you. We're gonna make her straight. Yeah. So now, guys, which you could not find in upper limb, here you can find for lower limb. Come here, please. So get the camera close. Can everyone notice that her
Yeah, there's a difference.
is smaller than right one?
Yeah.
Still, just to neutral the fact, I'm simply balancing her by bending in her knee and again checking it. Relax, please. Again, the same.
Okay.
So that indicates the left side hip is PI, means posterior inferior. Right side hip is AS, means anterior superior.
Anterior. Yeah.
Same way, in her case, we could not find that much easy in the creases of upper limb. But even that indicates on the position of the scapula and your shoulder.
Okay.
And everybody much aware about shoulder is not one joint. Four joint becomes shoulder complex. So here, this what we notice. Today, I'm not going to do any chiropractic correction, but only with osteopathy, after treating our entire body, we simply going to do the both test again. Where first we found right side is this a little bit shorter, no problem. We'll again check it. It may balance whatever the remaining one. But this is very significant what we can see. Only with osteopathy also we can get an amazing result. Okay, fine. So I would like to request my doctor to come on back. I'll take care. Thank you. Lie down straight. Okay. Now, this is my very simple assessment. Actually, there are many techniques in osteopathy, but this I find easy. There is applied kinesiology technique also. These are very vast and deep techniques. So rather than talking in today's session, we may have another session about the same, about only osteopathic assessments. Okay. So today after checking, I would like to go chain muscles, which I'm going to use very easily and get the results quickly. In upper limb, I treat sternocleidomastoid first, scalene, trapezius. So your coracoid ligament, pectorals, deltoid. There is the anterior, middle, and posterior. Bicep, tricep, your extensor digitorum, flexor digitorum means lateral epicondyle point and middle epicondyle point, interosseous membrane, thenar and hypothenar, and your there is a ligamentous article release wrist technique. I'm going to use for upper limb. I'm going to do bilateral. In osteopathy, again, it's not only just location specific. No, I treat my patient. No patient comes to me with one-sided issue, but I treat my patients for both upper limb just to balance. Cause a concept very simple. Whole body is one unit. So I do balance on both upper limb. For lower limb, is again, let me just finish the entire chain sequence. Psoas, iliacus, IT band, and then your quadriceps, your adductors, hamstrings, popliteus, your gastrocnemius, soleus, tibialis anterior, and then LS technique means ligamentous articular strain release technique for foot. So I'm going to release my doctor each and every muscle, this chain sequence plus both limbs, upper and lower limb plus both sides, right and left side, just to balance entire body. Okay, so let's start. I'm gonna go each and every muscles very slowly. If any doubts, you can ask me at the end of the session. So here I'm gonna talk about how my hand placement, my thumb placement, or which direction I'm gonna work. Each and every point I'm gonna cover. Okay. So first of all, I'm gonna start with sternocleidomastoid. So everybody is much aware about anatomy. I'm not gonna go deep. So origin, my index finger and middle finger I'm gonna use, and my thumb at insertion. So direction of force for my thumb is inferior. If I do it posterior, I may choke the patient. So simply make sure, this is very important precaution, a warning precaution. Because majority of the time, you don't press inferior, you press posterior. So patient simply chokes, actually coughs out. And for your superior, this is upper point at your SCM, simply posterior and superior. Okay, so I'm gonna go for posterior superior, and this is inferior. I'm asking my doctor, is there any choke or pain? Pain. So if it is paining, no problem. Ask your patient, pain is a part of treatment. Okay, but choking should not be. So this is hold this, hold this. This is LS technique actually speaking. So wherever is required, I'll tell you whether it's LS technique or myofascial release technique in osteopathy, what I'm using now. So hold is for 30 seconds to 90-second max, or else 30 seconds, 3-time repetition. Like this, inferior, superior, 30 seconds, 1, 30 second, 2, 30 second, 3. Though she's not actual patient, but still I'm going to hold this just to check the balances. 1 point. Second point is scalene. So again, for scalene release, this point is going to be same, your upper point. But lower point, this here is going to be posterior and inferior. One, excuse me, madam. This is posterior and inferior. Here, chances of choking is less. Okay. I hope, madam, you're fine. Yes. It's paining? Yes. Yeah. Again, hold this point 30 seconds. 1, 30 second. 2, 30 second. 3. So my third muscle is going to be trapezius. I'm simply going to hold my upper hand to a chin line, and my next hand going to be at the shoulder. Okay. So here, make sure again, you will not, it should be at the chin line very easily. And here down, many of the patients I found that when I simply turn the head, protraction happens. They raise because of the pectoral. She's not actual patient, so no worry. So here I simply press the shoulder down and we get amazing stretch here. This is my fascial release. 1, 2, 3. This is one of the technique, my fascial release. Okay. So after doing this, coracoid ligament now I'm going to work. So simply I'm going to request my doctor, be comfortable. So this is again LS technique. As I already discussed about, this is based on disengage, exaggeration, and balance concept. So here I'm going to use my both thumb, press posteriorly, and then approximation toward each other. I hope everybody can see that. Press posteriorly, approximation to each other. Here, no need to hold. No 30-second hold or like that. Just simply press down approximate to each other. Thank you, madam. Okay. After doing that, then your pectorals I'm going to work. Pectorals major to minor. This is junction of deltoid anterior and your pectoral. I'm simply going to go posterior, release, posterior, release. Yes. Then I'm at the deltoid anterior. Here, for deltoid anterior, I'm going to go from distal to proximal direction. See how? Posterior and distal to proximal direction I'm going to go. Release way. There are many principles where ligamentous articular strain release is based upon. Then this is medial and posterior. Same with distal to proximal. I'm simply using my pressure now anterior and upward. Okay, so this is deltoid. So here going to work on biceps from distal to proximal in 3 direction. Press posterior and then simple distal to proximal. Distal to proximal. Okay. Then for tricep also the same way. Distal to proximal. But the force gonna be anterior. As I already told about gate theory, is based upon a touch or impulse. So there's a firm pressure supposed to be, not too much, not too less. A firm pressure supposed to be. Okay. Next point gonna be extensor digi in 2 way, and then flexor digi in 2 way. So again, same. What I did, I simply press posterior and proximal to distal, proximal to distal. Okay. Now interosseous membrane, I'm going to use my both thumb downward direction. Okay. Okay, this is fine. Now I'm going to work on our thenar eminence from, now this is proximal to distal. Okay. And hypothenar proximal to distal. And then with LS technique. Okay, I'm going to ask my doctor just to relax the body, please. Thank you. And simply going to move my both thumb opposite to each other. One towards thenar, one towards hypothenar. So this is how quickly I covered one side, right side. I'm going to go for left side now. Okay. Now, be comfortable. Now head on opposite side. So I hope everyone is with me. Dr. Brerat?
It's going fine, sir. Yeah.
Yeah. So same sequence I'm going to follow on left side.
Okay.
First is sternocleidomastoid. As I already explained you everyone, but still just to give a balance, I'm going to go deep. Sternocleidomastoid, excuse me, madam. And then a scalene. Can we hold from up? Scalene. A scalene. Please repeat a rule of 30-second hold 3 times. And then trapezius opposite to each other. Okay. So again 3 times. Okay. So before coracoid ligament, I would like to cover one more point that is called plastisma. Okay. It's very, very important. Ask a patient to be comfortable and simply use your all 4 fingers going towards laterally and pressure towards superior. It's painful procedure. Very, 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 very painful. You can just see expression of my doctor. It's very painful procedure. Okay. So after releasing plastisma, first we have to go in one go. That's why balance on both the sides, one go, and then go for crooked ligament. Excuse me. Again here, go posterior and approximate to each other. One, there is no hold, excuse me. There is no hold. The few points which we gonna go with the holds, 3 time repetition. Even this is 3 repetitions to 5 repetitions maximum, but no hold. This is deltoid for anterior. Again, everyone can see my thumbs is posterior and distal to proximal, distal to proximal, medial, distal to proximal, distal to proximal. And for posterior, use the all 4 fingers, distal to proximal, distal to proximal. Again, requesting everyone to use firm pressure. For biceps, posterior, yes, yes, yes. For triceps, we can use both way, whatever is comfortable you are with. Okay, or this way, or maybe just with all 4 fingers. Distal to proximal, keeping the pressure towards anterior, and then extensor digi. Again, press posterior and proximal to, sorry, distal to proximal, distal to proximal. See, I think so. I'm in flow. That's why I'm a little bit in faster mode. But everyone can see very easily. I'm doing 3 repetition. 1, 2. Okay, like that. Now interosseous membrane. 1, 2, 3. Now here is all based upon how you cover it. Now down over here, relax, madam. Is simply hypothenar, thinner. For your thinner and hypothenar, you can go proximal to distal. And for your LAS is ligamentous articular strain wrist technique. So go away from each other and release like that. Okay. So this is how I covered upper limb osteopathic approach. Very easy way. Uh, Definitely many techniques actually I studied, but I thought why not to compile everything and just simply get a best technique which giving me a very quick result. Already I got n number of patients successfully treated with this technique. Now I'm going to go for lower limb. I would request everyone, yes, you can practice in your daily practice on your patients and check the results. You can get back to me, get back to Dr. Preregal about the same. I would like to go for now lower limb. One more important point, as I told about choking and pain. Same like that. There is one more important point you have to get notice in your patients. Tell them about osteopathic treatment is a painful treatment, but only while doing it. Make them understand. Otherwise, they'll simply start screaming. It's very painful. I cannot bear this. Simply make them ready for the basic. Then it's painful, but only while doing it. Okay, let's come to the point for lower limb. Is I'm just requesting my doctor. Can you show me the umbilicus? Yeah, your belly button is here. This is our ASIS belly button. So center of belly button and ASIS is your psoas muscle. Okay, I'm gonna ask my doctor to bend it in right knee. Yeah, I know it's painful. Sorry for that, doctor. Yeah, 2 and 3. Thank you. 1. So 3 times to maximum 7 times we can ask, depend upon tightness of the muscle. Then for iliacus, again do it. Yes. 2, 3. Thank you. Thank you. Now go for IT band. Okay. Doctor, can you come on this side? No, not you. Focus on. So entire TFL IT band starts from distal to proximal. Go for approximation technique. Here you press towards medial and approximate to each other. 1. Again press medial, approximate to each other. 2. Press medial, approximate to each other. 3. Now for quadriceps, support the leg very well from distal to proximal. Uh, Press posterior like that. 2, 3. Thank you. Then for adductors, again distal to proximal. Press laterally. 1 is painful. I know that. Sorry for the pain, madam. And then for hamstring, you're gonna go proximal to distal. This is I'm just working from medially to laterally. First the medial, proximal distal, proximal distal, proximal distal. This you can pressure simple anteriorly and proximal distal. Same way for lateral hamstrings. So anterior pressure, proximal distal, proximal distal. You simply can imagine anterior pressure, proximal distal, proximal distal, proximal distal. Now, I'm working on popliteus. Okay, popliteus again. It's simply you're gonna go anterior. Sorry, it's painful. I know that. Sorry for that pain. 1, medial, and yes. So here I'm working medial, middle, lateral for popliteus. Now for gastrocnemius is middle. Now this all points, the posterior points gonna be proximal to distal. Anterior points are mostly distal to proximal. It's all depend upon. I hope everybody must have heard of Dr. Janda, who has written an amazing book on myogenic chain. So it's all depend upon how your antagonists agonists are placed. Okay. So this is proximal to distal, but anterior pressure maintained. For lateral also, yes, yes, yes. Now I'm going to work on soleus. Okay. Again, anterior pressure, proximal to distal, proximal distal, proximal distal. Now for tibialis anterior. Yeah. So here I'm going to go press posterior. Now here I'm going to go both together. Yes. Or you can work like this also. The how I work with for biceps and like that muscles. Okay. So after finishing this, I'm at the ligamentous articular strain release technique for foot. Done. So how I worked on right lower limb. Now I'm going to come for left lower limb. So in lower limb maximally, I used a technique ligamentous articular strain release. Okay, madam. Can you bend it in your left? Left, yes. 1,
मेरी जानी का भी मैसेज इसका
2,
असर का भी मैसेज आया था ना
3,
बोले एक पेशेंट रेफर किया है मैंने
4,
आपको
5.
डॉक्टर
Thank
सीनू
you.
कुमार will call you.
Can you just?
सीनू कुमार right?
Yes, 1.
Sure.
Dr. Prerak, I think continuing well.
Yes sir, perfect.
Yeah, thank you. 3, 4, 5. So I have released both psoas and iliacus on both the sides. And can I come on this side? So again, same way I'm going to cover for medial pressure and from distal to proximal. Medial pressure approximate to each other. Okay, approximate to each other. Okay. Now just support quadricep distal to proximal. Posterior pressure. Yes. So again, I would like to remind everyone this LS technique is based upon disengage, exaggeration, and balance. Okay. Again, lateral pressure. Okay. Thank you. And for, as I already explained about the posterior muscle, I go proximal to distal. Proximal to distal with anterior pressure. Proximal to distal. Yes, and then popliteus is anterior pressure is painful. I know that. Sorry for that. Medial, middle, and lateral. Now for gastrocnemius, proximal to distal, proximal distal, proximal distal, anterior pressure, lateral gastrocnemius. Yes, and then soleus. Everybody can just see that I'm giving anterior pressure and proximal to distal. I'm working, and for this tibialis anterior, as I explained about, these are anterior muscle. So gonna go from distal to proximal. Okay, with posterior pressure. And this is my last technique is ligamentous articular strain release for foot. So this is let me explain you. I'm supporting this very well. Okay, can you focus on back, please? So I'm holding the complete foot. I'm completely pressing superior direction. How I do my LS technique for foot. So how I covered upper and lower limb with this complete chain sequence just to give the amazing result. So if everyone is ready, we can go for directly for the limb length test.
Yes, sir. I
And
think, yeah, we can, sir, please.
thank you. So I'm just requesting my doctor to be straight, not. So make sure she is in linear pattern. Ask her to keep body relaxed, give a good traction, and then shake. Yeah. There were no significant change, so here we cannot notice that much. But we'll go for lower one. Excuse, thank you so much. Come on, tummy. Face down. Okay. Again, make sure for linear, a patient should be so relaxed and straight. Yes. So still we can see that there is a difference between the left foot. So here I would like to go for one chiropractic correction for this PI, and but I never ever go for chiropractic directly without osteopathy. So if you guys allow me, I'll simply give one thrust and simply check for this one. Dr. Kiran, turn one second, please. Yeah, trunk out. Thank you. Down left leg. Give me a hand. On that side, please. Go ahead. Trunk out. More out. One side, please. Excuse me. No, down left leg, please. Give me a hand. Hold it well. Breathe in. On tummy, please. Face down. Thank you. So I'm not gonna cover the entire chiropractic process today, but gonna make sure I'm right on it, please. Yes, 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 yes. Guys, we can see now effective change. Dr. Prerak.
Yes, sir. Actually, there is a noticeable difference.
So, which I could not get only with osteopathy. That's why I do combination of osteopathy, chiropractic, and physiotherapy. Why?
Okay.
Because everybody is much aware about strengthening of alignment.
Okay.
Chiropractic osteopathy alone only can give only alignment, but it cannot allow you to go for long-term results. So experts are must in this matter. So, but in some cases we get these results only with osteopathy also. But still, I don't rely completely only on osteopathy or only on chiropractic. I go for advanced posture alignment. Okay? So how we got very nice results, a balancing. I'm going to ask my doctor to turn to one side, get up and walk and give us feedback.
Okay.
You are very tight. That is very first result what we feel that patient says that they are feeling light. Yes. Though today I had to add the chiropractic, but many of the time we get only with osteopathy balancing result. But no problem, because I really believe most in the concept of advanced posture alignment, and where we do combination of chiropractic, osteopathy, and physiotherapy. Yeah. So, Dr. Prerak, here I'm done with assessment part and treatment part.
Okay.
You can tell me if any changes, like yeah.
Yeah. Thank you, sir. It was a very nice session.
Thank you so
A
much.
lot of people have asked a lot of questions. I have a lot of questions of my also.
Okay,
So
please
on
ask me.
behalf of all these people, I'll just ask all these questions.
Yeah, yeah,
First
sure.
of all, sir, I would like to ask you, how much typically a session of osteopathy takes, the time, the amount of time which it takes?
Very, very nice question. I was about to say that actually, uh, treatment, chiropractic, osteopathy, both together takes hardly 15 to 20 minutes.
Okay.
Now, how much that I made myself fast? Otherwise, it takes half an hour. But
Okay.
I made myself sure a treatment should be finished of osteopathy and chiropractic in 20 minutes max.
Okay.
Yeah,
So, sir, matlab, when we go through this discussion, so do you
uh,
want to say कि in some cases the problem might be at some other joint, like you explained the concept of fascia, that
yeah,
how much fascia affects the body and what are the different,
yes,
how it can affect our mobility as well, our joints as well. So,
yes.
so can we, from your explanation, can we also come to an end that some pain in the PSIS or ASIS area can lead to pain in your shoulder as well?
Yes, possible. But I would like to say, as I explained about the fascia, a biokinetic chain, a spiral chain,
So,
but I would like to go more in detail. If it is a right shoulder pain, I'll consider a problem is in liver area,
okay, okay,
viscera. Viscera.
oh,
Definitely goes down to the hip region as well,
okay,
uh, because of basically all are interconnected through fascia.
okay, okay,
My suggestion, we have to focus on core,
okay,
which is based on viscera.
okay.
Yeah,
So basically, sir, if we consider whole body of fascia,
yeah,
if there is a knot in anterior part, it
ah,
may lead to some or the other pain in the posterior leg part. So you want,
absolutely right. So here we say bow and arrow theory.
okay,
Bow and arrow in that proper direction.
okay,
Yes, pressure in both the way.
okay,
Yeah, it is so
okay,
simple. Hmm.
okay,
That's why
and
in osteopathy they focus more on myokinetic chain and fascia and structure. Means they don't go just locally; they go generalized.
okay.
Hmm.
Okay, sir, I would like to ask you also that do you feel, see, as somebody who practices physiotherapy, osteopathy, and chiropractic, do you think that combination of all these three works much more beautifully than if we use these individually?
Yes, how? So, as I already explained while talking about advanced posture alignment, chiropractic osteopathy just simply gives alignment.
Okay,
As studied from Sweden, Stockholm, about this master of chiropractic,
okay,
there in Europe they use only chiropractic.
okay,
Call the patient thrice in a week only for chiropractic, and
okay,
patient keeps coming. Here,
okay,
I do only 3 sessions in 20 days, maybe in 1 month.
okay,
Because with my beloved physiotherapy, it helps to strengthen the alignment.
okay.
So easy.
So,
That's why there are some patient they comes and talks to me, doctor, I would love to go only for chiropractic or osteopathy. No physiotherapy I want. I've already taken my physiotherapy. I simply tells them we have different protocol with the chiropractic and with the chiropractic and osteopathy. You get alignment,
okay,
but what about strengthening of alignment?
okay,
It
okay,
is very very important. I hope, right?
okay. So
If
basically,
you don't
the
strengthen the
starting,
alignment, again, then you're gonna get back to square.
okay.
What's the
So
use of alignment?
So basically, sir, after this process
You
and
are with
after
me.
your osteopathy and chiropractic, basically physiotherapy treatment, it makes sure कि जो whatever changes we have made with these advanced techniques, they stay or they remain there. Yeah. Can you hear me, sir?
Sorry, yeah. Now I can hear you. Tell me again, please.
Yes. So basically, you are saying that whatever uh, whatever changes or whatever excellent results we achieve
Ah,
through these advanced techniques, physiotherapy makes sure that they remain there for longer period of time.
yes, yes.
Okay.
Long term is the only way how I talk to my patients. If you want short term result, go for separately. If you want long term result, I would like to compile all three.
Okay. Mahesh sir, like you said that you give 3 sessions in 20 days. So it
Yeah.
is something which you practice, or generally this is how osteopathy
No, no,
sessions
no,
are
no,
given.
no, no. This I practice.
Okay.
Means how I made myself sure for quicker result. Means like for example, if there is a patient, I call them for 20 days regularly. In that 20 days, there are suppose 7 to 8 matrix therapy sessions.
Okay.
Physiotherapy and matrix therapy gives balancing of muscles and structure before going for chiropractic osteopathy. And that in that 20 days, I do 3 to 4 max sessions.
Okay.
So how I practice alignment, and with this 20 days, strengthening of alignment.
Okay. And sir, whatever results we achieve with osteopathy, with chiropractic, are these results long term or the patient has to come
Long
again
term,
and again?
long terms. Believe me, now that day, like 2 days back, I got one patient from Ahmednagar,
Okay.
Shirdi, and before lockdown, I treated him only in one session for his sacrum pain, and he
Okay.
was suffering almost for 1 year and something like that, and he could not come on daily basis because of like far distance.
Okay.
But I explained him this is just a this may be a temporary one. But he visited me 2 days back after almost 6 to 7 months.
Okay.
And he's happy.
Okay.
He simply said that ki, I don't require to go for physiotherapy. I simply said that don't make mistake.
Okay.
This time he visited to me for lumbar issue.
Okay.
I'm sure there is no magic
Okay.
in chiropractic osteopathy.
Yeah.
If you touch and get a crack sound and then the magic happens. No,
So,
everything works on science base.
okay.
So I made him sure in Shirdi, I've given one address. I made sure he will go and visit there for exercise.
Okay.
Yeah.
Okay. Okay. So, last question for today, before we end this session. Sir, for these techniques, because sir, a lot of young people are watching this session, a lot of young
Yeah.
students who are still in their college, who are in their internship, who are just learning new things, they will
Mm.
be hearing this session and they
Yeah.
will take a lot of message home. Sir, I would like to understand somebody from you who has been practicing from so many years the importance of correct diagnosis,
Mm.
because what I have seen in my practice or
Absolutely right.
people which I have seen is people give these techniques, diagnosis, their clinical examination is not clear
Mm.
at all, and then
Absolutely.
ultimately they blame, the patient blames these techniques that they don't work. So please, can you
Absolutely.
put a stress, layer stress on this fact that how important it is to have
Diagnosis is
correct.
very, very important. Very, very important. Now, inside, I just made sure first I'll do diagnosis. I did not simply go for treatment
Yeah.
for the same reason. Otherwise, what happened? People simply follow a technique.
Okay.
I would be very happy if my colleague they practice as a doctor, not as a technician. We are doctors. We have to practice like a doctor by assisting. First
Yeah.
of all, assessment is very, very important. Right diagnosis is very, very important, and then plan treatment. The only suggestion to everyone:
Yeah.
don't be in rush. Don't be in rush to give result. Don't be in rush just to give techniques. No. Me and my few colleagues, like Dr. Pranak, we know about Dr. Praveen, Dr.
Yeah.
Farooq. We three are starving for more knowledge. Why? Because we would like to go more in deep in more perfection,
So
more quick result. So here assessment is very, very important, and then your treatment comes.
Because sir, I see a lot of these young kids, a lot of these young students, interns who have learned the technique, but
Yeah,
at the day's end, if you're not clear with your diagnosis, if you are not clear with the
exactly.
assessment, these techniques will not give their 100%, and you will end up blaming the technique rather than your own assessment.
In fact, patient also starts blaming the technique. And like there are some patients who approach me. I've
Yeah,
already taken osteopathy and,
yeah,
the chiropractic.
okay,
I I simply request them. I don't actually judge anyone, but I simply request my patient. Let me give one treatment to you, and then you talk to me. And
okay,
after it's all, they simply compares and then they get happy.
yeah.
So I'm requesting everyone, please go in deep. And if any question, yes, Dr. Predak, you can share
Sure.
my phone number also on the screen.
Sure, sir. I will surely do that. And sir, thank you. You could find some time for us, and
Thank
it
you
was
so
a
much.
very nice session, sir. Because a lot of people had a lot of doubts about this. What is
Yeah,
osteopathy, chiropractic? So I'm sure one third of the doubts have been cleared by you,
thank you so
and
much.
rest other about other techniques. Definitely, we will try to go in that also. But thank you, sir. Thanks a lot. You could find so much time for us, and you could teach us all these
Thank you so
techniques.
much.
Thank you, sir. Thank you for your time.
Thank you.